Thank you all for joining us today for our ILA New Network presentation on library partnerships with Reach Out and Read Illinois. We're so happy you're here and so happy that you're sharing space with us today. And with that, I'll pass it off to my colleague to introduce herself.
Hi, everyone. My name is Vina Vilivalam. My pronouns are she, her. I am a former public school teacher, and I've worked in public libraries in Illinois as well, and most recently worked at the Illinois State Library, supporting the adult and family literacy programs throughout the state. Um, I'm currently a senior program manager with Reach Out and Read Illinois. And my favorite children's book character is Arthur because we had the glasses connection very early on. And I'll pass it on to Olivia.
Hi everyone, my name is Olivia Heinsroth. I use she, her pronouns. I am a former early childhood professional and librarian assistant, as well as currently working part-time at a local library in my free time. And in my full-time position, I presently work as a program manager with Reach Out and Read Illinois. And my favorite children's book character would have to be two characters specifically, and that would be Frog and Toad because I love the cozy vibes that they emit, and I just achieve that every day. I try to.
That's a little bit about us, but we'd love to hear more about you and where you're joining us from. So, if in the chat you could share your name, your library system, your city, and your favorite children's book character, that would be great. Feel free to go ahead and do that as we move along.
All right, while you're sharing those intros in the chat, we're going to start watching a short video that introduces the Reach Out and Read program with a general overview. Don't worry if you're still unsure of what the program entails afterwards, because we will go into it a little in depth and what the Reach Out and Read model looks like from a practicum standpoint. So Vina, go ahead and start that video.
The Reach Out and Read program is an innovative and evidence-based early learning model. Pediatric providers use this model to engage families with children's books during well-child visits, from the 6-month visit to 5 years old. Reach Out and Read is expanding in Illinois. Let's hear from pediatricians across the state about why it's working, why they support it, and how you can help the Reach Out and Read Illinois program thrive.
The Illinois chapter of the American Academy of Pediatrics houses Reach Out and Read Illinois' program. And with our access to thousands of pediatricians across Illinois, we're able to connect and network with pediatricians and support them in their implementation of the program.
It's really an amazing way to engage patients in care. It's an amazing way to assess development. It's an intervention we can really provide meaningful interventions through the Reach Out and Read program. The support that we have received from Reach Out and Read first starts in our site. It's important to have a committed team in each site that can be a link between the sites and the Reach Out and Read Illinois program. And Reach Out and Read Illinois has been super responsive to our needs. When we need books, when we need donations, when we need anything that we need from the program, we have been able to easily reach them, and they have been super accessible and super willing to help us out growing our program.
We opened our clinic in 1996, and we started our Reach Out and Read program in 2002. And since then, really, it's become an integral part of everything that we do, our decorations, the training that we do for our physicians, what we talk with our patients about. Really, books are key to the work that we do here in this clinic. Nobody has to convince pediatricians about the benefits of this program. We can see it. We can feel it. We know when we walk into a room and we give the book to the patient, everything lights up. The kid smiling, the parent is excited. The relationship between the pediatrician and the parent is just, you can feel a connection. The parent feels like this doctor cares about my child, not just about their ears, not just about their health. She cares about my child's future. And that is, it's irreplaceable.
Reach Out and Read embedded into care can definitely help better health outcomes in communities, and they're going to be helping so many families and so many children continue to foster the love of reading for a lifetime.
Our literacy message for Reach Out and Read starts at the very beginning of the visit. As soon as they walk in, they see our brand, our logo that has a book on there. And that message is continued in the waiting room, where we have shelves full of books that they can read while they're waiting for their exam. During the exam, they get a book to take home. Reach Out and Read helps develop relationships with families by using the book as a bond. We give them a book. It's something to remind us about the visit, to read every day with family members, and it's something different that other physicians might not be doing. So Reach Out and Read helps create a more positive experience by giving those opportunities for those teachable moments.
I know Reach Out and Read is working in Illinois because the studies show us that it works. So for the last 30 years, the Reach Out and Read program has been the most studied nonprofit program. Reach Out and Read Illinois the studies have shown that parents that have the program read with their kids 2.5 times more than parents that go to clinics that don't have the program. And you see kids running into the clinic like so excited to get their book. Like kids are actually excited to go to the doctor when a clinic has a Reach Out and Read program instead of being scared to go to the doctor when they don't. We see that the program works.
There are book deserts across Illinois, so some of that is in rural communities where there just might not be a library within a few miles or even in the district. But then there's also like transient families that are dealing with homelessness, or low-income families, or families that are migrants. Like all of these different populations have their own struggles with acquiring books. And the program itself is universal, but we have worked really hard to intentionally expand to communities where there is lower book access.
You should be able to have access to the same program, the same books, and the same fidelity as well as any kid.
Books are not cheap, and board books for young children are not cheap. And a lot of families that want to provide the benefits of reading to their children cannot afford to do so. So not only are we helping families out financially from that perspective, but a lot of times parents don't 100% know what to do with the books past reading them. And the nice thing about the program is it provides a lot of education to providers in a pretty quick, easy to do training session that allows you to have the information to share with those families on how to make that reading time most effective. So the Illinois team is amazing at providing support, especially when you're first opening the program in your clinic. All you have to do is ask, and they will get back to you with a checklist of exactly what to do, how to do it, how to find funding, and any questions you may have.
I think it definitely helps to have that support system just to take that first step. And I strongly, strongly believe that together we can make a difference in the lives of many children.
And I think that having that human connectedness with clinic providers really helps boost that ability to meet families where they are and help them get to where they want to go.
The reward that you get from using Reach Out and Read is priceless.
You don't think about it when you're seeing your patients that maybe you're actually also impacting their future kids.
There is nothing like the joy of being able to see a smile on a child's face when they recognize that you are going to be giving them a gift, and that is what it is to them.
It is really impactful, and I hadn't realized until that point quite how impactful it was going to be.
And I will never practice without Reach Out and Read in my practice.
Thank you so much for sharing that video with us, Bina. On the next slide, as the video mentioned, the Reach Out and Read program in Illinois is housed in the Illinois chapter of the American Academy of Pediatrics, and we are fully operational statewide with over 180 current clinics. Thanks to dedicated advocates and legislators, our program is made possible through funds provided by the Illinois Department of Public Health, with the goal of every child having the relationships essential to learn and thrive.
So again, Reach Out and Read is an AAP endorsed evidence-based early learning program. Medical providers, including nurse practitioners and physician assistants, enter the exam room with the children's book in hand. And in each newborn to 5-year-old well child visit, providers take the opportunity to discuss with caregivers the importance of shared reading. The program has been shown to increase the amount of time families spend reading to children, improve child language abilities, and improve clinic culture and clinician well-being. On the next slide, you'll see the Reach Out and Read model in action.
So Reach Out and Read begins when the routine well child exam begins, by using the book as a tool from the very, very beginning. Providers that are trained in the Reach Out and Read model talk about shared reading and its benefits, demonstrate how to effectively spend time together with the book engaged in its content and beyond, encourage caregivers to and maintain routines around books, and at the conclusion of each of those visits, they provide the family with a brand new book of their own to keep. All the while, providers are using the book as a tool to monitor developmental surveillance and see how the caregiver and child interact with the book and each other.
In addition to effectively improving caregiver and child relationships, the Reach Out and Read program also helps in building trusting relationships between caregivers and pediatric providers. Oops, wrong slide. Pediatric providers. Another key aspect of the program is that it supports families in building their children's at home libraries. And honestly, the program just brings joy into the exam room where there might be nerves and otherwise uncertainty of the unfamiliar environment. It says to the family, as the video mentioned, that the provider cares about the child and their future.
And so we keep saying that Reach Out and Read as a program is evidence-based, but what the research really says about our program is that we're the only nationally endorsed early literacy program of the American Academy of Pediatrics. We see time and time again that our outcomes fare better than other early learning and reading interventions. In fact, caregivers who engage with the Reach Out and Read and its model are 2.5 times more likely to read to their children. Families are 2.5 times more likely to report enjoying spending time together reading, and the linguistic abilities of children are greatly improved over time. So you've heard a lot about what our program is and what its goals are and what our mission is. So please feel free to share any questions or connections you might have with us in the chat. I see we've already got some love from some people about what the connections are with our program, but we'd love to hear any intervention questions about our program first and foremost. So our program is a fully nonprofit organization, but we are in part sponsored and are not sponsored, funded by the Illinois Department of Public Health. But it is like once a clinic implements the program, they are kind of on their own in their own communities trying to fund the program. So they usually utilize internal and external organizations like their foundation at the hospital system or other external organizations.
Amazing, Terry. So good to hear that your granddaughter benefits from the program. Um, and Rhonda, you are on the right track. So we're about to actually launch into that, how we partner, and we're going to share some very specific partnership strategies as well. So one asset we usually encourage our Reach Out and Read clinics to tap into is their local community library system, because it's our hope that a love of shared reading will blossom from our program and will serve as the beginning of a lifelong love of learning. Let's see. And reading. So the journey continues at the library. In fact, libraries that partner with their local Reach Out and Read clinics see a decrease in the common barriers to library use, which are the lack of information about the library and its program, mistrust of the library as a system, concerns about immigration status and legal documentation, and the belief that library is not for children, and so on. So the reasons may vary, but it may be due to the trusting relationship between the families and their pediatric care provider that leads them to go to the library.
And so what that partnership kind of looks different for everyone, but what we've seen time and time again with our partnerships that we currently implement, that partnering with your local Reach Out and Read clinic can look differently, but it can be very effective. And there are certain ways that we've seen that are very effective. One strategy is to utilize grab and go kits. The Chicago Public Library staff created these kits for their local clinics, practicing Reach Out and Read to provide to their children. And they include supplies for activities, instructions for how to engage in an activity, and information about connecting with their local library. Some examples you'll see on this slide include emotions and motion cards, which give families tools for effectively talking about emotions and giving them strategies for managing big feelings, as well as sock docs, in which children create a sock puppet and are encouraged to check out book titles related to the activity.
While grab and go kits are wonderful tools, they're not always the appropriate strategy for your clinic. Another tool to tap into is co-branding materials to be provided to your local Reach Out and Read clinic. So these can be as simple as diverse books, lists rather, that relate to a holiday or celebration, posters for clinics, to hang in their exam room or waiting rooms, tickets for providers to give their patients that encourage them to go back to their library for an activity or prize, or our favorite prescription pads that prescribe patients to read. And we have those in Spanish as well.
Yes. But though those are extra things you can be doing, oftentimes the most effective and best way for encouraging families to come to the library through their pediatric care clinic is to utilize things that you're already doing, such as promoting the library and its wonderful services through the clinic. I encourage you to use this to your advantage that clinics are more than happy to promote your services. Perhaps you could share your calendar of events with them, offer to host a story time in their waiting room, or share other materials you already have for families, such as coloring sheets, bookmarks. The possibilities are honestly endless. And we've even seen some clinics do during library card sign up month in the waiting room or outside the waiting room doing a library card sign up event where they try to boost the amount of people that are signed up for library cards. So as we mentioned earlier, a great way to engage with families is through the use of grab and go kits. So I'm going to go into those a little bit more in depth. So these kits can be a simple craft or a package of pre-made library information packets. I put a link in the chat already that shares the things we've already brainstormed and worked out with the Chicago Public Library, but we'd love to hear more ideas in terms of partnerships that we could work on and collaborate with materials more for. And then another strategy to keep in mind is that you are members and contributors to your local community. So you know their needs and you know their needs best. So take the time to ensure that you're offering activities and resources in various ways, such as utilizing different languages spoken locally or at differing literacy levels so that they are accessible to all families and their needs.
The hardest part of this process is starting the relationship, but the most important thing you can do for your local clinics is to ensure that they're supported in their efforts to spread the word and help them and maintain that relationship with them. So feel free to share an email address or stop by regularly if your schedule allows you to. Clinics that participate in Reach Out and Read share the mission of supporting reading and early learning in families the same as you. Another pro tip is not to overwhelm clinics and providers with your support. A lot happens during a well child visit. And while we know you have the best interest of the child at heart, it's easy to get carried away. When connecting with providers, meet them where they're at and support their efforts in a way that can be mutually beneficial for both of you. Might be helpful to discuss beforehand if they would be interested in grab and go kits or co-branded materials, as some health systems have regulations that restrict these strategies.
So we've shared a lot with you today and a lot of ideas, and we want to take some time to ensure that you're well supported in your good-natured efforts of expanding your reach to include Reach Out and Read clinics in your area. Please take some time to share any questions, ideas, or best practices in the chat. And I will say too, if you are interested in partnering with a local clinic and you're not sure where to start, please utilize us. We are more than aware of the clinics that are practicing in the state, and we'd love to connect them with you.
Carrie, thanks for mentioning the podcast. We'll actually share a link for other folks to listen to the podcast if they're interested. It's on our link tree. Carrie would
If
be
you have any
happy to look
clinics
that up.
yeah, we would be more than happy to look up McHenry County clinics.
We don't know that off the top of our head, but we will get back to you. Oh, yeah, he's amazing.
Dr. Nosaria is incredible. We love him so, so much.
And for folks who are not familiar with him, he is a pediatrician. He's also has a library science degree, and so has kind of been really an advocate, a staunch advocate for Reach Out and Read.
He is also the host of the Reach Out and Read podcast, which is just fantastic in and of itself.
We have plenty of time, everyone, for questions, so please feel free to use the Q&A in the chat while we're here. Oh, it's another comment about the physician. Okay, please feel free to use the Q&A in the chat. Anyone?
That's amazing that he came into the appointment. That's really exciting.
Okay, it doesn't look like we have any more questions. Okay.
Do you want to take us to the last? Oh, you're very interested in this in your community near Palos Hills. So we'll have our email addresses at the end of this slideshow, and you can more than happily reach out to both of us, and we would be more than eager to try to connect you with the local clinics if there are any in your area. So who reaches out to establish a relationship with the clinic? You or the libraries. So it would be up to you and your discretion on what you have the capacity to do with the clinic. However, we would be more than happy to give you the contact information if the clinic is willing and able to accept any assistance from the library system.
Sometimes it's parents, sometimes it's, and we could also support that, help facilitate that if you identify a clinic in your area that you'd like to. And sometimes it's just word of mouth. Like, I know a pediatrician, I want them to, um, launch this program. We are kind of, we actually Reach Out and Read is a universal program. So we kind of work with any clinic serving any demographic throughout the state. We do have a targeted focus to expand, outside of Cook County and other parts of the state, and as well as in Cook County. But, we're trying to really reach every corner of Illinois. And so, any way that we can support you in establishing that contact, and helping them work through the application. It does take a few months to kind of get it going. Um,
Rhonda, and I know where you're from because I'm from the same area that you're
mhm.
from, Rhonda. And there is a clinic that is practicing, and they are more than eager to reach out to the clinic or to the library to get partnership going with you.
Yeah. And we do have some clinics that host a pediatrician story time. I think we may have mentioned that. I just came from a visit at Will County where there's a family practice doc that might be doing a pediatrician story time, and start that up at the library there to kind of just increase visibility of their community health center, but then also build trust and build connection with the community. We we're really working with Reach Out and Read to kind of increase and expand access to multilingual and bilingual books. We don't currently translate to other languages aside from Spanish, but we are seeing like a growing need for that. And so, that's something that we could look into. But we do have books in our office currently in Arabic, in Haitian Creole, and we try to just check in with clinics and see what their needs are. Olivia, did you want to add anything to that?
I don't have anything to add to that. That was great.
Okay, well, I don't think that there are any more questions. Our wonderful presenters have included their contact information on the screen, so please feel free to jot that down. And they've
And then we
also
just wanted to take some time to thank you for your time today. For more information, please take a look at our link tree, which I posted in the chat. And we invite you to join us for an upcoming webinar we are hosting with the University of Chicago regarding reading with neurodiverse children. And then if you'd like to connect with us any further, our email addresses are on the screen there, and we will be sharing slides after this as well too.
to thank you both so much for sharing all of your goings on at Reach Out and Read Illinois. We truly appreciate, well, ILA truly appreciates you sharing this with the Illinois library community. Thank you so much. And thanks everyone for attending. Please feel free to reach out to both of our speakers if you have any more specific questions. And I want to thank the wonderful speakers today from Reach Out and Read Illinois. And thank you everyone for joining. And we hope everyone stays warm and safe. And this all for joining us today.
And thank you for hosting us. We're really appreciative of the opportunity to work with the ILA on this.
And they also mentioned the webinar that will be in this week's ILA Alert newsletter that comes out on Thursday. So be on the lookout for that information as well. So thank you all. Bye, everyone.